My name is Crystal Keene, and I'm an RN studying at St. Petersburg College. The purpose of my presentation is to investigate the usefulness of Hippocrates' application for nursing professionals in their daily practice. I will be discussing the purpose, utility, usability, legal and ethical issues, and overall analysis. Hippocrates has many different features, but my focus will be on the drug guide. This mobile application launched in 1999 and is compatible with iPad, iPhone, Androids, and desktops. According to Modern Healthcare magazine, Hippocrates was their top choice as the most important medical app. The purpose of this app is to enable healthcare providers to deliver better patient care through state-of-the-art mobile technology. Evidence has shown that mobile devices allow healthcare providers to be more efficient with their work practices. This app also supports clinical decision, saves valuable time, and most important, keeps the focus on the patient. This application has a multitude of relevance to the nursing practice. It's the most commonly used drug reference application out on the market. It may be used as a handheld device that can substitute multiple drug, infectious disease, and laboratory reference books. It's also a great source for patient education. Here from the home screen, you can see where you can select a few different features about drugs. Here you can review drug prescribing and safety information. You can see the interaction checker to show potentially harmful drug interactions, and the pill identifier in case you need to find a specific pill the patient describes to you. On the following slides, I will give a demonstration navigating the drugs and interaction checker.
So under adult dosing, you can see it gives different dosages for thromboembolism, DVT prophylaxis, renal dosing, and hepatic dosing. Adverse reactions, the most common reactions are bleeding, back pain, and pruritus. Under pharmacology, you can see it's metabolized in the liver, excreted in the urine and the feces, and even the mechanism of action. You can also see a list of pill pictures. So if you want to get back to the home screen, you can press the E in the top right corner. This application also has an interaction checker. You can check up to 30 different medications to see any drug interactions. I went ahead and filled in 4 here. I'm going to go ahead and say view interactions. And you can see that it says avoid use or use alternative with Plavix and Xarelto. And then if you click on it, it gives you the way of risk and benefit.
Hippocrates offers free and premium software. It's a #1 medical application that is user-friendly, easy to learn, you get fast results, and you can use the app offline. Once the app is open, you can simply click the featured categories, or the user can simply use the search bar at the top of the application, as pictured on the left. The picture on the right shows more detailed information on the premium software, Hippocrates Plus, that delivers even more clinical intelligence, including over 40+ evidence-based clinical practice guidelines, in-depth disease content, alternative medicines, and labs. The annual subscription costs $174.99. There are a few legal, ethical, and privacy issues found under the terms of use and the disclaimer information. This app is not a replacement for sound clinical judgment, evidence-based research, and fundamental scientific principles, and should not be used in replacement for an actual visit with a licensed professional. The disclaimer for the drug interaction functionality is based on 2 drug combinations that reflect only paired interactions and do not reflect interactions arising from combinations of more than 2 drugs at a time. If you were to purchase the Hippocrates Plus with a credit card, they encrypt their transmission of that information. However, no electronic storage is 100% secure, so they cannot guarantee absolute security. When using their mobile app, they may share your information with third-party services. The overall analysis is it's convenient with easy-to-use features in the palm of your hand, anywhere, anytime. You have access to quick updates rather than having to buy a new book or edition, and supports clinical decision-making at the point of care. One limitation is the hefty fee of $174.99 for Hippocrates Plus. However, I would recommend the free download for the drug information and interaction checker. So in conclusion, Hippocrates proves to be an invaluable tool for healthcare providers. It provides essential content necessary for clinicians at the point of care, accurate, unbiased, current up-to-date practice standards, and is all relevant for healthcare professionals. It also offers user-friendly features and increases efficiency, keeping the focus on the patient.